In 2001, the Department of Health launched a 10-year programme to tackle sexual ill health and modernise sexual health services. There has been some progress, including an overall drop in teenage pregnancy rates, but the number diagnosed with HIV and STIs continues to rise. Under NHS reforms, local authorities are now responsible for commissioning sexual health services locally, bringing together new opportunities to improve sexual health in our community.
We know and we understand our communities, and we have ways in which we can reach them quite successfully. So, for example, messages to young people can be delivered through schools, through youth service, etc., message to old people through our older people's forums. And if we couple those knowledge and networks with the already expertise within public health and within Cheshire and Merseyside, then I think what that does is it brings together that marriage of really important knowledge and understanding and skills to get those messages across.
One issue with accessing sexual health services is confidentiality, and people wanting to travel to a different area to seek advice or treatment. How will local authorities address this?
Well, of course, this is a challenge for local authorities because we will have to make sure that no matter where somebody chooses to go for their sexual health service, they get the same quality of service, they get the same package of care, but that it doesn't cost differently depending on where you go. So one of the options we have is to have a single tariff approach where we're able to, no matter where somebody goes for their services, the local authority will expend the same amount, whether it's locally or whether it's much further away.
I think it's very important that patients do have that choice of where they access services and also of what different services are available. Community services currently are well used to providing that access to patients. I think the issue that arises here is one of funding. And I think that's where perhaps the development of community sexual health tariffs will improve funding, and it will allow for patients to have a much wider choice. I think it is also vitally important that there is good clinical input and support for the commissioning bodies. Any commissioning decision has to be based on sound clinical practice. I think it's very important that they would work through the Cheshire and Merseyside Sexual Health Network. The network provides a forum for clinicians to come together and develop and share good clinical practice, but it also provides a forum for clinicians, senior clinicians, to meet with commissioners and help to influence the commissioning choices.
For frontline staff like Dr. Jim McVicker, who deliver these services on a daily basis, their input into the commissioning process will be vital. With the rise of HIV and STIs, effective sexual health awareness campaigns are needed to reach the public. Public health professionals have expertise in this area.
I think also making the best use of some of the new media that we have, or social media, using different forms of getting communication of sexual health promotion messages across. It's a time to, I think, try and think a bit differently, think innovatively about how we reach out to people. The old routes of sending out leaflets, sending out messages through billboards and things like that are not as effective as we'd like them to be. So in moving to a new place, we can perhaps try and provide some innovative ways of talking to people. And actually, that's what councils are really good at doing.
There's an opportunity for us to join up some of those services that perhaps were not as joined up as they should be. We all know that a lot of people's sexual health is determined by factors other than the direct issue of sexual health. So, for example, we know that alcohol is a huge issue, particularly with young people and their sexual health. Now, we provide services through alcohol support and through work that we do with young people, that if we were able to join up those services together, will produce much better outcomes, in my view, for those local people.
By working together to deliver appropriate and accessible services, we can improve sexual health in our communities.